So good afternoon everyone. I'm Pooja and I would like to welcome you all to another live session for reading from Let's Update Language Again. So as you can see on screen, I would just like to give you certain instructions for those of you who are attending for the very first time. That is the OET reading subject is subdivided into three parts. It is part A, part B and regarding the number of questions, you will have a total of 42 questions and you will have 20 questions from part A, 6 questions from part B and 16 questions from part. And regarding the time duration, what I need to tell you is that you will have a total of 60 minutes or 1 hour to crack the test, of which part A will be allotted 15 minutes. For part B and C, you will be given 45 minutes. Okay. So now I would just like to tell you that so today we are going to have a discussion of OET reading module part C, and so basically what this part checks is that it assesses your ability to identify the detailed meaning and opinion in two different set of text. Okay, each having around about 800 words each, and these texts will be based on topics of interest to healthcare professionals. Okay? And it could be research topics mostly, okay, and any topics of interest to healthcare or healthcare related topics. And part C will consist of, as I told you, 2 long texts, and that will be followed by 16 questions. And the nature of questions will be 4 option multiple choice. And so now, how do you go about approaching part C? So first what you need to do is you need to read the question to know what information you need to find. Then read the content of the text, that is the paragraph, which will have the answer, and then read the answer options and decide choose the most appropriate answer. So let me tell you that in part C, usually it is structured in such a way that the first question will be from the first paragraph, second question from the second paragraph, third from third, and so on. Okay, but in cases where you will not have just 8 paragraphs instead of because you have 8 questions from each text. So in that way, you should ideally have 8 paragraphs. But in certain cases, you will have 6 paragraphs. So in that case, you might have one more than one questions from a paragraph. Okay, in that case. And in cases where you have 10 paragraphs or 9 paragraphs or 11 paragraphs, in that case you will have paragraphs from which you will not have any question at all. Okay, so because you will have a set of 8 questions from an extract, okay, from part C. Okay, so this is the pattern. So you will have 8 questions and ideally 8 paragraphs or more or less, slightly more or less. So the order is in such a way that the first will be from the first paragraph and second is usually. So in that way, it is easier to actually find out the answer, and usually you should spend about, ideally you should spend about around 2 minutes for a question to find the answer, not more than that. In case you happen to spend more than that, just leave it there, skip it and come back towards the end if you have time. Okay, but because it's not worth spending a lot of time on a question, because we have a lot of questions in solve. So now we shall, these are the general instructions for those of you who are attempting for the very first time. So I would just like to start the discussion of a part C module. Okay, so usually, as I told you, the structure is such that there will be the extract will consist of 7 or 8 or 9 paragraphs, and that will be followed by 8 questions, okay, next to each other. But for your convenience, and because it's a live session, and for your convenience, I have structured the question and the paragraph in such a way that these are next to each other, that you can see the paragraph and the question and the options at the same. Okay, so that is a way now this is structured. So you can see this, as you can see on the screen. So this is the first paragraph and followed by the question. So I'll give you a minute or two to read this paragraph and read the question and the options, and then we shall solve it together. After solving this, you can give your choice of answers in the comment section, Facebook and YouTube. Okay, so good afternoon and hello to all those who are joining us live on Facebook and YouTube. So, yes, hello Sandra, Renzi Liju, JV Joseph, Sonia Bemins, Anjana, Hamad Khan. For those of you who have joined in just now, so I have given 2 minutes to read this paragraph and solve this question. So and try to solve it and put in your choice of answers in the comment section, Facebook and YouTube. Okay, I can see the answers coming up already. So yes. I'll just read this paragraph then. So, the relatively common neurologic movement disorder known as restless leg syndrome is poorly understood. Patients describe uncomfortable sensations in their legs that often are worse at night, having a huge impact on their ability to sleep and overall quality of life. Experts now speculate that patients with RLS, like those with unrelieved chronic pain, might feel hopeless, leading to suicidal thoughts and actions. The risk correlates with the history of depression and is independent of the severity of restless leg syndrome and demographic factors. So this is a paragraph, and the question is: writer suggests that the restless legs syndrome, option A, is impossible to cure, B, could lead to depression, C, doesn't occur during the day, and D, may relate to pain management. So what do you think is the correct answer? The answers that I can see coming up on the comment section is Meeravan has responded with B, Bijay Aju with B, Sharath S. Shiva with B, Rinsi Liju with B, Anjana M.A. with B, and Sonia Bibbins with B. Yes, and that B is the correct answer. So yes, it indeed could lead to depression. So I'll just highlight the answer and the section of the paragraph which has led it is to this correct answer. So they are talking about RLS over here, and What RLS, what they have mentioned is that this or the risk correlates with the history of depression. Okay, so yes, so restless leg syndrome would indeed lead to depression, and that is why we have chosen and the option B as the correct answer. I hope this is clear to you. Moving on to the next paragraph and the question. So, as you can see on the screen, this is the paragraph and this is the question following it. Question number 8. So, I'll give you a minute or two to read this and then we'll discuss it together. Okay, so I'm going to read this paragraph. So, although evaluating restless leg syndrome and finding effective treatment is challenging, recent studies suggest that it's important to assess not only the impact of RLS on the patient's life, but also the presence of suicidal thoughts. People with severe RLS are more likely to plan and attempt suicide than people without it, even after controlling for depression, according to new research. Lifetime suicidal ideation and attempts are very prevalent among people with restless legs syndrome and seem to be independent of demographic factors and depression and seem to be associated with severity of restless. Said Brian Coombe, MD, Director of the Yale Center for Restless Legs Syndrome, Yale University, New Haven, Connecticut. So, this was what the paragraph was about, and the question is Brian Koo suggests it's important for clinicians to treat any suicidal thoughts because. So, and the options are A, older people are more likely to suffer from RLS, B, the effect of RLS can be better identified, C, it makes managing RLS much easier, and D, RLS is a mental health condition. So, what do you think is the correct answer? You can in your choice of answers in the comment section in Facebook. Okay. Bijay Ajo, Mary Jyotish Jomi, Sharat and Shiva have all responded with D. Harsha Kurup and Shirin Gio has responded with D. Any other choice of answers? Okay, so try to read it again and decide and choose the most appropriate answer. Okay, so option B is the effective RLS can be better identified. It's RLS, and option C is it makes managing RLS much easier. Okay. There are no spelling mistakes in the options. Okay, it's just the yeah. So don't think that it's RIS and don't choose any other answer. It's RLS only. Okay, so yeah. Okay, so I'm getting other options also. Meeravin has responded with C. Manju Manoj with C. Rincy, Liju, and Biji have responded with B. Okay, so in different options. So yeah. Naufal, CB Kunju with C. Okay, so I'm going to give you the correct answer. The correct answer for this question is indeed C. So good. All those who have responded with C, so that's good. So look at this. So, and I'm going to highlight the part of the paragraph that has led us to this answer. So that is, so what does this question suggest? That is, it is important for clinicians to treat any suicidal thoughts because. Okay, why is it important? Okay, so for clinicians to treat the suicidal thoughts. Okay, so it is actually mentioned over here in the very first part of the paragraph. So what does it indicate? Look at this. I'm going to highlight this part. It's important to assess not only the impact of RLS on the patient's life, but also the presence of suicidal thoughts. Because people with severe RLS are more likely to plan and attempt suicide than people without it. Okay, so that is the reason. So they are saying that it is important to assess the impact or the presence of suicidal thoughts also when assessing the impact of art, okay, because they are interconnected. Okay, and that is the reason why we have opted C as the correct answer. I hope this is clear. Right. So now we are moving on to the ninth question. Okay, so the ninth question is also from the same paragraph. Okay, so I just have to minimize this for you to see both the paragraph and the answer options. Okay, so I'm going to read this paragraph. Yeah, it's already read, right? So, yeah. So what do you think is the correct answer? So when you have two questions from the same paragraph, what you need to remember is that the first question will be from the earlier part or the top part of the paragraph, and the second question will most likely be from the lower part of the paragraph. Okay, so yeah, so this is belonging to the lower part of the paragraph. Okay, so they are hinting at something that the ale team learned from their investigation. Okay, so what do you think is the correct answer? Please respond in the comment section in Facebook. And I'm just going to read the question and the answer options. What the Yale team learned from the investigation? Option A, some people in the control group had previously suffered from RLS. B, likelihood of someone developing RLS depends on various factors. And C, answers to the question is, didn't provide a lot of useful data about RLS. And D, a person with RLS is more likely to attempt suicide than someone without it. And you can either reach the answer directly if it is directly mentioned, that is, if it's explicitly mentioned, and if it's not directly mentioned and it's indirectly mentioned, in that case, you need to eliminate all the other three options if you have enough evidence to prove the other three options incorrect. So that is called the elimination method. So you can opt for either of these. Okay, um, so depending about whether the answer is directly mentioned or not. Okay, so I can see the answers coming up. Ninth one. Okay, so Anisha Anish, BG Ejo, Bissy Nubi, Tina Thomas, Meera Wen, and Rinsi Liju has responded with B. Are you sure that is the correct answer? Because, and Devika Deva responded with B. Yeah, because okay, look at this paragraph. I think like most of you have actually misunderstood some part of this paragraph, I guess, because look at this line. Lifetime suicidal ideation attempts are very prevalent among people with restless leg syndrome and seem to be independent of demographic factors and depression, not dependent. They have said independent. Independent in the sense it is not dependent on these factors. That is what they have mentioned. It's independent. Okay, note that word. Okay, that means it is not dependent on other factors. Okay, so how can you actually go with B? The likelihood of someone developing RLS depends on various factors. They are saying that it's not dependent on these various factors, so it's independent. So you cannot actually go with B. So that is something that you're going to eliminate first. Okay, so I think you have, yeah, changed your answers, all of you. So, yeah, Mary Jyotis, Jomi, Biji, Jo, Daya, Rajesh, Bisinu, we have all gone with D. Lindsay, John, Anjana, MA, Harsha, Kurup have gone with D. Okay, so let me tell you the correct answer. It's indeed D. D is the correct answer. So, good. So, all of you who have answered correctly. So, now let's look at this. Okay, so this, and I'll just change the highlight color. So, yeah, understand, because the answer starts from here. People with severe RLS are more likely to plan and attempt suicide than people without. That is what the Yale team investigation tells you, or that is their conclusion. So, and it continues till the end over here. Okay, but even if okay, the next sentence is to be taken also, but that implies the same, that people with severe RLS are more likely to plan and attempt suicide, because the next sentences also tell you the same. Lifetime suicidal ideation, ideation in the sense the thought or the idea of suicide, okay, so and the attempts, okay, are very prevalent among people with restless leg syndrome because they are interconnected and seem to be independent of other factors. They are not dependent on other factors but this, that is RLS, okay. So that is why our answer is D. A person with RLS is more likely to attempt suicide than be someone without it. Okay, so I hope that is clear to you. So we'll move on to the next question. Okay, so the next paragraph does not contain any question. Okay, so we'll move on to the next paragraph after that. And yeah, again, two questions from the same paragraph. So as you can see on the screen, hope that's visible to you. So now I'll give you a minute or two to read this paragraph and decide and choose the most appropriate answer for the question that follows. Okay, so I'm going to read this paragraph. Mood and anxiety disorders are highly comorbid in RLS patients, noted John W. Winkelmann, MD, PhD from Harvard Medical School and General Hospital, Boston. My feeling is that the suicidal ideation or even plan of intent, and even some who have followed through, is the same thing you see in patients with chronic pain. In many respects, RLS is a chronic pain disorder, and if you have chronic pain for which you feel there is no appropriate treatment and your physician may not understand what you have or may not know how to treat it appropriately, it can lead you to feeling hopeless, and I think pain and hopelessness can lead to those kinds of thoughts, Winkleman said. Okay, so the first question from this paragraph is the expression followed through refers to followed through. Okay, so I'll just highlight that part. Okay, and here you have this phrase here, followed through. Okay, what does that refer to is the question. So you can put in your choice of answers in the comment section in Facebook. Okay, okay, so Lindsay, John, Sharath S. Shiva, Harsha, Kurup, Lejuke Nair, and Anjana may have gone with A. Mary Jyotis, Rinsi Liju, Bisi Novi have gone with B. Okay, and the rest of you. Yeah, I can see answers coming up in YouTube also. Ranjini G, Mohan, KRJ, Anshu Jacob, Chitra Sridhar have all responded there. Okay, so this Abu, Udaya, Rajesh, Honey, Johnny have all responded with B. Sharon, Gopika, Sharon and Deba Hafiz have all responded with A. Gopika, Akshay, B. Okay, so let me give you the correct answer. The correct answer for this question is option A. So look at option A, Artless patients who have attempted suicide. Okay, what does this word follow through? Okay, a set of these words follow through mean. Okay, look at the sentence. Okay, my feeling is that suicidal ideation or even plan or intent, and even some who have followed through in the sense those who have attempted suicide, attempted whatever. Okay, wherever this follow through set of words come, okay, it is the attempted, they have actually attempted that. Okay, so they are talking about suicidal ideation, this is idea of suicide. Okay, or even the plan or intent to do so. Okay, and some who have attempted it, that is followed through. Okay, so the meaning is that they have attempted suicide with respect to that sentence. Okay, that is what follow through means. Okay, okay, so now moving on to the next question. The question is, okay, from the same paragraph. I hope this is visible to you for the question and the options. Okay, I'll just read the question. John Winkelmann's comment in the fourth paragraph shows his option A concern that a lot of doctors have never heard of RLS. B. Believe that RLS relates to many other health conditions. C. Frustration that too many people with RLS commit suicide. And D. Understanding of the situation um, faced by a lot of RLS sufferers. Okay, so these are the four options. Okay, so what do you think is the correct answer? You already read the paragraph. So, okay, so Lindsay John have responded with D. And rest of you, yeah, JV Joseph has responded with D. So, as I told you, if you have two questions from a same paragraph, the first question will be from the upper part of that paragraph and upper half of the paragraph, and the second question will be from the lower half. Okay. Keep that in mind. You don't have to search for like the entire paragraph for the answer. Okay. So it will be structured in that way. Right. Okay. So I think you are reading that all over again. Yeah. So yeah. John Winkelmann. Okay, look at this. So here is mentioned over here. Winkelmann said. Okay, so what did Winkelmann say? Okay, look at this. Okay, the entire thing, entire whatever is said in that paragraph is said by this man, Winkle man. Okay, and what does he say is that if you have chronic pain for which you feel there is no appropriate treatment and your physician may not understand what you have, or may not know how to treat properly. Okay, in that situation, okay, he is telling you about a situation where you have chronic pain and your doctors don't understand or don't have the suitable treatment or the appropriate treatment for that condition, or for that, it can lead you to feeling hopeless. So he is telling that he understands that. So he is telling that, okay, so if this is the situation, in that case you might actually feel hopeless. And he also thinks that pain and hopelessness can lead to these kinds of thoughts. What kinds of thoughts? Suicidal thoughts. Okay, so basically these are all interconnected. So if you have RLS and if your doctor does not know how to treat it properly, in that case you will feel hopeless, and you will feel this hopelessness actually can lead to suicidal. So these are all interconnected, and he understands that, and he is giving his what do you say, insight into this. Okay, so and because of which the correct answer for this question is going to be D, understanding of the situation faced by a lot of RLS sufferer. Okay, because he understands that, and that is why he is giving you this kind of a statement. Okay, um, yeah, because usually if there is no appropriate treatment available and the physician or the doctor cannot treat it, and that is going to uh, lead lead you to feel hopeless, and pain and hopelessness will jointly contribute to suicidal thoughts. This is what he understands, and this is what he says. Okay, it's because he has this understanding. I hope this is clear to you. Okay, so A can be clearly eliminated because it's not his, he's not showing concern about, okay, a lot of doctors don't know or never heard of that. He's not saying a lot of doctors have never heard or something like that. If in case, if the doctor doesn't know, that is the condition he's actually mentioning. So A is incorrect, and B, believe that RLS relates to many other health conditions. No, he is not telling you about many other health conditions, just about suicidal thoughts and its connection. And what about C, frustration that too many people with RLS commit suicide? No. He is not telling you, or he is not showing any sort of frustration. He's just telling you his understanding of the condition and his understanding of how it leads to suicidal thoughts. Not any frustration that he is showing. It's not evident anywhere that he is showing any kind of frustration. Okay, and that and he's also not mentioned that too many people are doing that. Okay, so that is also not mentioned. So we are left with option D, and definitely it's his understanding of the situation, and it's his statement that is mentioned here in this paragraph, and because of which it's D. Moving on to the next question. I hope this is clear to you. So the next question, and this is the paragraph. So I'll give you a minute or two to read this paragraph and come up with your choice of answers in the comment section on YouTube. So I'm going to read this paragraph. One such case is Lisa, a 45-year-old married woman who came to see a psychiatrist initially for depressive symptoms. During the initial evaluation, She complained of difficulty in falling asleep and other depressive symptoms such as low mood, difficulty with concentration, poor appetite, and low energy, along with daytime fatigue. Depression was diagnosed. A selective serotonin reuptake inhibitor (SSRI) was prescribed on an as needed basis, and the patient was advised to take a nightly dose of diphenhydramine to help her sleep. 3 days later, after staying up nearly all night, Lisa called her doctor in despair, complained of worsening insomnia. On more detailed questioning about the insomnia, Lisa revealed that for the past 2 years, she has experienced leg discomfort when she gets into bed. She is so uncomfortable that she needs to walk or ride on her exercise bike past 2 or 3 a.m. until the discomfort subsides. While not painful, this leg discomfort sometimes prevents her from relaxing and watching television because she just has to move her legs. So that was what the paragraph was about, and the question is the case involving Lisa highlights that, and the options are A. Some patients don't follow the recommended advice for RLS. B. Regular exercise is recommended for people with RLS. C. Sleep problems and exhaustion could indicate RLS. D. Medication is important in the treatment of RLS. Okay. So, what do you think is the most appropriate answer? Okay, so I can see many of you from YouTube. That is Ranjini, Jimoon, Chitra, Sridhar, are all going with C, option C. And let's look at the Facebook comments. Lindsay John, Sandra, Deepa Hafiz, Leju Kenar, Mary, Jyotish Jomi, and Anjana Hamu have all gone with C, option C. So I think it's an unanimous choice of answer. So yes, the correct answer is indeed sleep. C. So good. All those have answered correctly. Sleep problems and exhaustion could indicate RLS, and that is explicitly mentioned here. That is in the case of Lisa. So during the initial evaluation, look at the sentence. Yeah, she complained of difficulty in falling asleep. Okay, so that is mentioned, and also exhaustion in the sense, yeah, low energy, along with daytime fatigue is tiredness, that is the same as exhaustion. Okay, so yes, that is mentioned here and highlighted here as the case involving Lisa. So, and that is the correct answer. So, I think even though the paragraph is a little lengthy, but I think you can easily locate the answer. It is easy. So, I hope this is clear to you. Okay, direct answer. Okay, so moving on to the next section, the next para, and the question. So, I hope this is visible. So, I'll give you a minute or two to read this, and then we'll discuss it together. So I'm going to read this paragraph. So Lisa describes a deep, uncomfortable sensation that feels like bugs crawling in her legs. She also reveals that her mother used to suffer from similar nighttime leg restlessness. Lisa's leg discomfort became more intense and was lasting most of the night. After secondary causes of RLS such as iron deficiency, anemia, pregnancy, uremia, and neuropathy were ruled out, SSRI and diphenhydramine therapy were stopped. Low-dose dopamine agonist therapy was started, after which the symptoms subsided. However, despite resolution of the RLS symptoms, her depressive symptoms continued. This only serves to further reinforce the need to investigate and treat any associated mood or anxiety disorders in conjunction with RLS. Okay, so this is what the paragraph was about, and the question that follows is, in the final paragraph, the writer suggests Lisa's treatment was changed. And the options are: A. New diagnosis was made. B. She no longer had depression. C. SSRI medication wasn't working for her. D. She developed a range of new symptoms. So you can decide and choose the most appropriate answer and respond in the comment section in YouTube and Facebook. Okay, so Lindsay John, Lechuke Nair, and Anjana M.A. has responded with A, option A, and Mary Jyotis and Anjana Ammu have responded with C. Okay, and the rest of you, what about the rest of you? Sharon and Anjana Ammu have responded with A. Okay, so let me tell you the correct answer is indeed A. So all those have answered correctly. Good. So look at this. So I'm just going to highlight that part of the paragraph that will lead you to this. Okay. So A is the correct answer. And why is it A? Okay, look at this. So Lisa describes a deep, uncomfortable sensation that feels like bugs crawling in her leg. She also reveals that her mother used to suffer from similar nighttime leg restlessness. Okay, so now, and Lisa's leg discomfort became more intense and was lasting most of the night. Okay, so it's not a new range of symptoms, as you all know. There were these symptoms earlier. It was mentioned the earlier paragraph also. There were issues with, or she had some restless leg syndrome, and but here what they have mentioned is it has become more intense, or it has become more worse or severe. Okay, and was lasting most of the night. That is what is mentioned here. So it's not definitely not a new range of symptoms, it just got worsened. Okay, so it's not D, you can eliminate D over there, right? So and definitely it's not B also, because she no longer had depression is something that is totally incorrect. Okay, because we have already mentioned about that in the earlier paragraph also. She had this issue as well. Yeah, so it's not B and D, and it's between A and C. And then they have not mentioned that SSRI medication wasn't working for her. It's not like that. It's not mentioned here, but definitely a new diagnosis was indeed made over here, because mm, as they have mentioned that it got worse, and it was lasting most of the night, or it became more intense. After that, what happened? So they made a new diagnosis and they ruled out a set of conditions such as iron deficiency, anemia, pregnancy, uremia, and neuropathy, etc. were ruled out. When do they rule it out? Okay, when they actually do another diagnosis. Okay, a new diagnosis was made, and then these conditions were ruled out, and after which what they did was they changed the course of treatment. Okay, so then they actually stopped SSRI and diphenhydramine, and then they started low dose dopamine agonist therapy. Okay, so that was what is mentioned over here. Okay, and after that the symptoms subsided also. Okay, so this is what is crucial, or what is more vital, and has led us to this answer. This is option A, new diagnosis was. Okay, so I hope that is clear to you. And now we are going to the last question, and the last question is also from the same paragraph. Okay, so now I'll read this question. 14th question: what does the word "this" in the final paragraph refer to? This. Okay, so I'll just highlight that word so you can know where is, which is the "this" they are referring to. I'll just highlight it in green. What does it refer to? So if you come across words such as this, that, these, it, etc., you have to read the previous sentence to know what the subject is. Okay? So that you can identify what they are referring. So you can respond to this. You can choose and decide most appropriate answer, and you can put in your choice of answers in the comment section, Facebook and YouTube. Okay. Cannot see option D. Okay, just okay. So I can see answers coming up. So Lindsay John have responded with D. Leju Kenan has also responded with D. And the rest of you, yeah. So look at this word. This only serves to further reinforce the need to investigate and treat any associated mood or anxiety disorders in conjunction with RLS symptoms. That is sentence. And what does the word this refer to? So you have to read the previous sentence. However, despite resolution of the RLS symptoms, depressive symptoms continued. This only serves to further reinforce the need to investigate and treat any associative mood or anxiety disorders. That is what they are trying to say. Okay, so this means what? Depressive symptoms. Okay, even though the RLS symptoms subsided or it got resolved, what continued? Depressive symptoms continued, and that only serves to further reinforce the need to investigate and treat the associated mood or anxiety disorders. So that is what they like intend to say. Okay, so what should be the reference? Okay, so what should be the correct answer then? Yes, so it should be option D. Okay, Lisa's unresolved depression. Just going to highlight that. That means her depressive symptoms. Okay, that is with reference to that. Okay, so that is Lisa's unresolved depression. Both mean the same. Okay, so I hope that is clear to you and you have understood this. So now it's time to wind up the session. So I hope you have understood whatever we have discussed today and this session was useful to you. So so thank you for joining us and see you next week and take care.